Good afternoon to all of you. So this paper doesn't really fit that well in this session. It's not about impact of cash transfers. It's mostly part of a broader project a comparative project on social protection systems around the world that UNU-WIDER is organizing. And so they decided to fit me in this session. So it's going to be really more of an overview paper of the social protection system in Egypt and its components. And it's co-authored with Irene Silwanis from Cairo University. So basically, we analyze here the two components, main component of Egypt's social protection system, the contributory social insurance and the non-contributory pensions and transfers, and ask whether the systems shape the incentives of firms to create good quality jobs and those of workers to remain in low productivity informal jobs. And the idea is inspired to some extent by major work by Santiago Levy that describes how the system in Mexico provides low incentives to join the higher productivity economy by subsidizing kind of this non-contributory pension systems. Now, the scale and reach of the contributory system is quite wide. It starts with, there are several schemes. The first being the scheme for regular salaried employees, which you'd think is the most comprehensive. It insures the most risks in terms of disability, survivorship, old age, end of service, work injury, unemployment, etc. And it requires employers to be formal in order to register workers and pay their own as well as the workers' contributions. And also it requires the relationship between the employer and the employee to be a regular relationship. So that covers a certain part of the workforce. Then there are the employers and own account workers themselves, and there is a narrower list of risks that this system insures. While it's mandatory for employers who want to register and have formal activities, as well as some professionals who want to get licenses to perform their occupations and professions, drivers who want to drive commercial vehicles, etc. It does not cover very well the employers and own account workers in informal firms that are not registered. Then there is a system for irregular workers, that there are really two subsystems, one for just any irregular worker and one for specific categories of workers that also have irregular sorts of employment. They also insure a narrower set of risks. And both of the above systems, the worker has to register themselves if they want to get any benefits or they want to be part of the system by paying their own contribution. And then the employer contribution is either subsidized by the government in the case of irregular workers or financed through a kind of a lump sum fund that employers pay into based on their sales or turnover. Now, that system exists, but doesn't really do a very good job in covering the workers of that category, and I'll show you some numbers in a minute. Then there is an optional scheme for Egyptians working abroad, and they can decide to pay their own and their employers' contributions in order to get a retirement pension in Egypt. So complementary to this, there are the non-contributory social assistance programs. And in 2015, this was restructured in something called the Takaful and Karama program, which has become quite well known, modeled after some of the Latin American cash transfer programs. And it's tax and donor financed and targeting poor and vulnerable households. Takaful part is for families with children, and it's supposed to be conditional on children's attendance in school and taking the children to health centers, etc. But even though the conditions have been designed into it, they have never been applied. So it's really effectively an unconditional cash transfer program. And then the Karama is for other vulnerable groups like elderly, poor, the disabled, widows, and orphaned. And it's really a consolidation of a bunch of previous pension programs and other assistance programs that existed before, consolidated under that particular scheme right now. I want to spend a little bit of time on the eligibility for these non-contributor sort of social assistance, because they're the ones that provide the incentive structure that we'll talk about later. While there is a basic proxy means test that is applied to households to decide whether they're eligible or not, but then in addition to the proxy means test, there are a bunch of exclusion criteria. And in effect, the exclusion criteria says that if you touch the contributory system in any way, through any household member, either who has a socially insured job or who has a pension through a contributory system, then you're not eligible for the non-contributory system. And even it says any household member working in a regular job, even if not socially insured, that earns more than the minimum insurable wage is not eligible, but the government has no way of detecting the income of people in the informal economy. And so effectively, the main exclusion criteria is that if you're registered in the contributory system, or anybody in your household is, then you have no eligibility. So you can see what sort of incentives that can create for people who think they could be eligible for the non-contributory system to essentially leave or stay out of the contributory system. So let's look at coverage for a second. I know this is a bit of a detailed table, but I want to focus your attention, on the first three categories are the regular salaried employees, and they could be public sector, who are covered, of course, at very high rates, 81%. But then it falls off quite considerably if you're in the private sector, even if you're a regular private sector employee inside establishments, which is a category that the government can enforce easily. You have a 36% coverage, but if you are outside establishment, even still regular, but you work on a vehicle or in a construction site, etc., then you have coverage rates drop to 17%. And then you have the group of own account and employers and self-employed workers, and their coverage is in the 23-25% rate if their enterprise is licensed. But if their enterprise is not, and that comes under other employers or other self-employed, the coverage rate goes down to 2 to 4%. So being in the formal economy is really critical if you want to get if they're to be covered at all, but even in those in the formal economy, or at least who have registered enterprise, are only covered at about a quarter of the workers. Now, irregular workers, as you can see, have a coverage rate of 3%, which is almost negligible. And then contributing family workers are also very low coverage rates, even if they are working in registered enterprises. So overall, coverage rate of social insurance of 31%, and that rate has been declining over time, not increasing. And you can see the top line, the blue line is the wage workers, the red line is the non-wage, so includes the own account workers, self-employed, etc. And then the green line is the overall average, and you can see that has been dropping, and the fastest rate of decline was in between 2014 and 2017-18, and that coincides with a period in which the minimum insurable wage was rising quite fast. And so a lot of employers were at least pushing off the low wage workers from the roles. Now, if we look at coverage by education level, and you can see that here I have coverage individually or through the spouse. You can see that there is low coverage at low levels of education, and it jumps quite considerably at the university level, which these are the workers that are more likely to have formal jobs. But overall, for the population, coverage is less than 25%, and women are obtaining their coverage primarily through their spouses rather than themselves. Now, also by decile of household wealth, a very strong gradient, as you can imagine, with the the wealthier groups being more likely to have formal jobs, and big jumps at the 5th and 7th and 10th decile. So there are certain jumps at the top part of the distribution, and again, the maximum coverage reach is in the 40 to 45% range, even among the wealthiest group. So this is for the contributory system. Now I'm looking at the 65 and older, whether they receive pensions. Okay, thank you. And whether the pensions are contributory or non-contributory. So this graph includes both, and you can see that the receipt of pensions is quite high, right? 70 to 80% of elderly are receiving some kind of pension. Of course, those at the lower end of the distribution are mostly non-contributory. Those at the upper end of the distribution are contributory. And at the 4th decile is where you have people fall in the middle. They're neither getting this or that. And so you can see that that's where the dip is. Let me skip a bit. This is the non-contributory social assistance, and of course it has the opposite pattern of being highest at the lowest decile of wealth and lowest as you go up the wealth, and overall only 14% of the population is receiving some sort of social assistance. I'm going to skip this and look at the adequacy of these programs. So pensions, regular pensions, civil servants, regular employees replace about half of per capita income, whereas those that are for irregular workers or business owners replace only 20 to 25% of per capita income. So those are the kind of the contributory pensions. So moderate adequacy, but when you look at the non-contributory transfers and pensions, we're looking at much lower percentages of per capita income, somewhere between 6 and 10%. With the Sadat pension plan that's being phased out is one of the pensions that is being phased out, so it's a little higher. But essentially very low adequacy in terms of amounts being given for the non-contributory pieces. Now let's look quickly at the governance. Now the big problem with coverage is we have low coverage among irregular workers, among regular workers outside of establishments. So these are people who are not easily, where it's not easy to enforce the rules, and those working in micro and very small establishments, fewer than 10 workers. So together, these three groups make up 83% of all uncovered private employees. So it is about the formality of the establishment that is basically, and the type of work that's being performed that results in the non-coverage. It's not so much about lack of enforcement of the rules among formal employers. And micro establishments make up the vast majority of establishments in Egypt, 89%, and they are much less likely themselves to be registered than their counterparts. So the enterprise informality is a major constraint to increasing social insurance coverage. Now, if we look at, these are some numbers, but I think I have 2 minutes, so I'm going to skip that graph. But anyway, it just shows you that rates of coverage is very strongly related to the size of the establishment, and the vast majority of uncovered workers are among these very micro and small, very small establishments. So incentives. So the cost of formality is high for firms, and the cost of providing social insurance, especially for low-wage workers, is quite high. It's been reduced a little bit through recent reforms, but it remains quite high. But costs of formality go well beyond the cost of providing social insurance. So even if you fix the social insurance system in terms of reducing the cost of contributions, there are still myriad regulations and provisions that provide fixed costs that loom very large for micro and small firms. So you're not going to, while there's been an attempt to fix this through a new law called the MSME law of 2020, that tries to reduce the cost of registration and licensing, etc., there is limited evidence on the effectiveness of this law so far. This is just a graph showing you the distribution of firms by size and formality, and you can see that the vast majority of firms are the 1 to 4 micro firms. What about individuals? And this is where I alluded to earlier on. The system currently makes the contributory social insurance and non-contributory social assistance almost mutually exclusive. So it produces incentive for people who are eligible or on the verge of eligibility for social assistance to avoid taking up formal jobs. So what data do we have on that? We have panel data that essentially shows whether people were able to make certain transitions in the labor market. Okay, I'll stop. In the labor market between 2018 and 2023, and we look at people who did not have social assistance in 2018 versus those who did. And you can see that certain transitions, like transition from informal employment to formal employment, are much lower among the group that had social assistance. Now, clearly, we need to do more multivariate analysis to establish that these differences would survive controls and other but clearly, they are much less likely to transition to formal employment if they receive social assistance at the beginning of the period. Now, I'll skip that, but basically, we have a misalignment of incentives, both for enterprises to become formal and for workers to leave the non-contributory system, which provides them current benefits, to join the contributory system for future benefits and insurance. And clearly, if you're going to increase social protection coverage, you have to do something about the enterprise space and enterprise formality, and design better schemes for workers who are vulnerable, irregular, or who are in less standard employment arrangements. And thank you very much.